We would like to welcome Hannah Brown, Manager of Outreach Services with Traverse City Health Clinic, and Dr. Kelly Clark, Family Medicine Physician with Munson Family Practice. They will be presenting on the TC Street Medicine Mobile Medical Unit. All right, go ahead.
Good morning. Thank you for having us. As Suzanne said, my name is Hannah Brown. I am the manager of outreach services with Traverse Health Clinic in Traverse City. I have the honor of working with the TC Street Medicine team, which is a collaborative between Traverse Health Clinic and Munson Healthcare. We also collaborate with Goodwill Northern Michigan, and together we form the TC Street Medicine team. So today we're going to talk about, what our team is, who we serve, the services we offer, and what that looks like in our region, and why we're doing that. So I'll let Kelly introduce herself as well. Oh.
Hi, good morning, everyone. It's nice to be here today. We're always excited to talk about what we're doing in Traverse City and in areas beyond, specifically in your region currently. And so we're excited to be able to partner with a lot of the different community organizations so that this is a better experience and source of resources for people who may need some and maybe find it a little hard to access. So we're pretty excited about what's going on and working together with the different communities that we serve.
Well, and then.
Thank you.
Yeah. Let me see if I can. Okay. So our mission with TC Street Medicine, we bring care directly to unhoused families, individuals, in many different locations. So we really primarily focus on going to shelters, encampments, if we are able to find them, and then locations where people kind of congregate, and that might look like community resource locations. So like John mentioned, Central United Methodist Church. We go to Safe Harbor, places where it is convenient for individuals to go to seek resources, to seek meals. And our goal in going to those locations is to try to reach people to either offer health services or offer services to connect them to resources that they may need. Here's a list of some of the services that we offer, and this is just kind of a high-level list, a broad list of some of our most frequent services that we tend to see. So on our mobile unit, we can kind of see patients and individuals who may have wounds. So anything from a sprain or an abrasion, burns and lacerations. We can see people for chronic disease management, so people with high blood pressure or diabetes, and we can assist with managing those diseases. We do have staff out with us who can assist in getting patients enrolled in Medicaid. We can help with connecting people to other types of resources, whether it be, housing assistance or DHS assistance, as well as assistance with if they're experiencing opiate use disorder, substance use disorder, we can help them kind of seek services and treatment for that.
One of our goals among all these things that we can treat is really to try to partner with the local providers in town and see if we can help people get the ID that they need so that they can get the Medicaid, so that they can establish with a long-term primary care provider. That really is what we'd love for people to do, but we know that some people just aren't ready to do that. And so we're there to help connect people and get them in the right direction so that eventually a more stable relationship with a healthcare provider can happen. But sometimes life is such that is just really hard for a lot of people. So it's a way to help bridge some care that is hard to access, whether that's because of distance or driving or transportation, and help to keep people from getting so sick that they end up in the emergency rooms. And that was one of our motivations in doing this, is helping to keep people a little healthier, and then to help preserve access to some of our other resources since we're in a rural environment.
Thank you. Yeah, as Dr. Clark mentioned, really focusing on connecting people with primary care is one of our larger goals. So we do see a lot of patients who do have a primary care provider, but like she mentioned, we kind of place ourselves in locations where we're more remote, or where patients may not have access, or they have transportation insecurity. So it may be more convenient to seek out the mobile services, but we are able to coordinate with those primary care providers or pharmacies and kind of help bridge the gap until that patient is able to make it to their next primary care appointment. We do see a lot of patients who don't have a primary care provider. So in placing ourselves in those more remote locations, we try to also strategically place ourselves in a location where it is feasible for a patient to get to a primary care provider that is local. So, for example, in Traverse City, we are in several locations, but if a patient seeks out our services and needs to establish care with primary care, we are able to help that patient establish care in many different areas in Traverse City. Whereas in Kalkaska County, right now we're located in Rapid City with our truck. So that thought with kind of going to that location is a lot of our referrals may be going to the East Jordan Family Health or Bel Air Family Health. It's still a little bit of a distance from Rapid City, but that location really offers a lot of wraparound services for patients, such as primary care, behavioral health, dental, medication-assisted therapy. So trying to place ourselves strategically so that patients can access the care that we may be referring them to.